Sure.
So that's for tomorrow then, for me.
Well, you had mentioned when we were talking about the policies and procedures, like having one of you guys in that might be beneficial, so.
Oh, okay.
And just
But this is what we're doing.
That's right, I was.
gives you guys, yeah.
want to be presumptuous.
Oh, no, come on, I think there's some people not gonna make it tonight, so if you want.
I'm at Morrow's.
Thank you.
Where's he from?
RDS.
Michigan?
My Michigan. He's already has a problem with it, so I think someone more local.
All right, you guys, it's 5:00. Started. Let's start with pledge allegiance. Shannon, can you start for us?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, I guess before we start the approval, we have a few new guests tonight. Let's do a quick round table.
Sure.
My name's.
I'm Sonia Reisner. I work for Catholic Human Services. In my Michigan, here in town, the New Health Park, with Care Recovery Coach. And Sharon had invited me to come here. So welcome aboard. Well, thanks.
I'm Shannon Davidson. I work for Asaba Valley CMH as a certified peer recovery coach.
Joyce Metro, person in long-term recovery, and I'm the project director for the Northern Michigan Opioid Response Consortium, which is a federally funded grant project in Northern Michigan that serves over 25 counties.
My name is Scott Izzo. I work with District Health Department number 2, and I am a community health director and epidemiologist.
Excellent. Charles Wiltsey, Ogemaw County Commissioner.
Justin Rogers, Director of Ogemaw County EMS.
Tim Dolahanny, County Administrator, and kind of like the secretary tonight.
Yeah. Okay, and who do we all have on Zoom?
I am Kathy Dollard. I'm the Service Line Director for Behavioral Health at My Michigan.
I am Trisha Ziegler, and I'm the principal at Ogemaw Heights High School.
Hi, I'm Dr. Mahaver from the Medical Examiner's Office.
Hi, I'm Rihanna Merrill. I am the Community Assessment Coordinator for the Technical Assistance Collaborative.
I am Dr. Dave McGram. I'm the Medical Director of the Northern Michigan Opioid Response Consortium. I'm from Traverse City. I'm also on the Grand Traverse County group that is working to allocate our opioid settlement dollars.
All right, thank you everyone for being here. Has everyone been able to look at the agenda? I'd like to approve the agenda.
I'll make a motion.
Shannon seconds, everyone say aye.
Aye.
All right, is there any declaration of conflicts of interest? Anyone? I wouldn't see that would be a case for any reason. So, were everyone able to look at the minutes from our September 14th meeting? And if so, if we could accept those.
Move to approve the minutes. Kathy Dollard.
I'll support.
Everyone say aye.
Aye.
Okay. All right, Tim, feel free to add on to this conversation here as we moving forward too, please.
The next item on the agenda is the discussion with Rihanna, and I know she wanted to capture a screen here. And share some things. You recall, Rihanna did provide that survey that was sent out to everyone, and she did also provide this afternoon a handout that is titled Sample Guiding Question. I want to pull that up, and with that, Rihanna,
Thank you. Let me see if I can share my screen for everyone that's here virtually too. Not letting me share my screen. Not sure if that's on my side or not though.
pull up a menu here and see if it's something I need to do.
I can help with that. If you click on participants. And then scroll to her name and then right click, make co-host. Or click on those three dots. Like, there you go.
I'm not really talented moving this mouse.
You're doing good.
Uh-oh.
I give that option.
Try clicking on her picture box in the top right corner. Yep, right there, the three dots again. No. When you set up, when whoever set up the Zoom, you have restrictions on giving access for screen sharing. So it's not gonna work.
A quick text message to your IT guy in Newberry. You might tell me how.
Amy's not with us tonight.
Amy is in Tennessee and off the grid. So,
Okay.
Who's,
We won't.
was the meeting open from that laptop there?
yes.
Yeah, you're gonna need IT. Because if it was opened by someone else on Zoom and they're the host, then you could fix it, but your host is right here in this room, so.
Yeah.
I think also, it might be easier, but we can
Jim.
just talk too.
There's a button in the bottom right-hand corner that says claim host. If you claim as the host, then
There
you
you go.
should be able to offer those permissions.
I did not see that.
I don't see it till now.
Oh,
No.
it's a good thought. Yeah, it was good.
Almost.
Is there a document that you might be able to put in the chat?
Yes, that is good thinking. I actually don't know if I can because I don't know if it'll allow me to upload files. But we can still just talk about it and I'll just take notes extra good on my side so that when I do share it later, it'll be all set for everyone. So what the document is it's a list of kind of sample guiding questions for a community assessment. It's guiding questions for a community assessment are what guide the community assessment. So they're things that we want to consider as we're going about the process of the community assessment. As we're creating surveys or conducting focus groups, it's what's kind of in the back of our mind that we're wanting to answer with the report that we're eventually going to lead up to. And so I provided some sample ones just because it can be easier if we have an idea of where to start rather than a blank page. So this is by no means saying that we have to go with whatever is written down here. I'm encouraging that we kind of talk about it. And I'd like to hear more about what you think we should be asking because this is your county. You're going to have a better idea of it than I will. So the first one is, what is the scale of the opioid epidemic in our county? Which is a very large question. A lot of these are going to be large. With sub-questions, who experiences opioid use disorder? And we can change it as well to be substance use disorder. What are the contributing causes of opioid use? And who does opioid use disorder affect indirectly? So this is a broad question, but do we feel that that is something we want to kind of be asking? Are there any follow-up questions that we might want to dig in a little deeper on this kind of background question? And another thing to consider is that we might have answers to some of these already with background data or reports that you might have or have knowledge of. And so when we do already have the answers, sometimes more questions can come out of that too. So we aren't necessarily looking for the end answers right now, rather than just an idea of what we're looking to question within the community.
So if I understand this right, you're trying to say we need to define the scope of the problem.
Mhm.
and kind of how it affects the community and the citizens of Ogemaw County. And once we understand that, we can kind of have a better, I guess, understanding of, you know, some of the things we might do to fix it using these funds.
Yeah.
Okay.
You're asking, we're gonna ask the community.
So
These
these
are
are
the-
kind of like the questions we want to answer, I guess.
Oh, that we want to answer before we, okay, gotcha. Okay.
Whether it's before or during, so. These might not necessarily be something we would ask in a survey, but it might be something we want to answer in a survey, if that makes sense. We might phrase it differently, but it's still the general idea we're looking to get.
Are you looking for consensus from this group to say, yeah, these are good questions or good things to answer?
Yeah.
Okay.
This one's a little more difficult because it is kind of like a background demographic one. So if we want to just move on to the next, and any opinions or consensus, anything like that is what we're looking for. I just want to have a discussion with you guys because while I might think that these are good questions, you might think that's not something we need to answer here, if that makes sense. So the second question is, what assets exist already to respond to the opioid epidemic for residents in our county? And then the sub-questions of, when individuals are ready and willing to get help, how accessible is the process? What resources are most utilized within the community? And what resources do individuals feel the most supported by and why?
One thing I'd like to see as a component of that is what resources does the community, what do they feel is available versus we know what resources we have. But if I'm an end user or a person who's addicted, I certainly may have a different perspective than an EMS professional in my case, of what resources are available. So truly getting in a picture of what does the community think is available and being able to compare that to what we actually do have available.
Kind of like a environmental scan.
Yeah.
Yeah.
And that might be something that us who work with clients in the community, we can ask them.
Yes.
Hey, you know, yeah, we can ask them that because I mean, to get it from them, they're the ones who are utilizing them and looking for them and have gone to treatment and they've gone through the process. So they're going to know best.
I was gonna say, yeah, it would be really nice to kind of like break down, like, what does the general public kind of know is out there versus the people who have struggled and gone through the system of dealing with the substance use disorder services. What do they know about? And kind of like creating those two piles.
Yeah, yeah, absolutely. We could come up with something that we could do with our clients. You know, when we meet with them and get their input on, you know, how they feel about it, what they think is missing and what they could use more of and, you know, that sort of thing.
I know a lot of my clients that I've asked that, and me myself being in recovery, is getting out of inpatient and being an inpatient and leading a structured life in there, getting out. There's no intensive outpatient in the community here, which is 3 days a week. I know 1016 does that. And hopefully they'll be moving up here. They are in Standish, Gladwin, Harrison. They're moving this way. There are so many things that we're lacking in Ogemaw County when it comes to recovery. Yeah, we're good on meetings. We have a lot of meetings. We can always use more meetings.
Yeah, you don't have any recovery housing, you don't have a recovery community organization,
no
you don't have a
recovery
recovery
community here at
community
all.
center. Those are some things that you can do to support the people who live here so that when they come back from treatment, they're able to thrive and grow in that same environment. Most often people go into inpatient treatment and they thrive really well, but when they return back to their environments that may be toxic and the communities don't have the resources that they need, they tend to go back to their old ways. They didn't have those resources. You know, they had everything of resources at their fingertips while inpatient treatment. They had connection to social people, interactions. And then when they come back here, if there's not recovery housing where they can live in a safe environment, free from abuse or substances, most often it's one person that goes to treatment. They return to a home where drugs or alcohol are very prevalent and they'll fail because of that is their environment. it's really hard to overcome that for most people, but having recovery housing as another stepping stone, as a need for this community would be huge. Recovery community organization or a recovery community center where they again have social activities that are, you know, all throughout the month. And you'll find more people in your community that maybe didn't have a substance use disorder problem gravitate to those recovery friendly events because they never dabbled in that stuff before. And now you have an overall healthier, growing community, if that makes sense.
Yeah, makes a ton of sense. Question, Shannon, the 10-16, you said,
So
what is it?
intensive outpatient is 2 to 3 days a week, 4 to 5 hours. When they're just when they go from inpatient into the community, whether it be sober living, house full of sober people. We don't have any of that in Ogemaw County. It's groups, it's therapy, 2 to 3 days a week, intense. So they still have that structure going in there.
It's a carryover extension of support from what they received in an inpatient setting. So it's brought out into the community and then they still, you know, attend meetings, like she said, 2 or 3 days a week, sometimes 4 or 5.
I moved from Kent County. I was down in Kent County for 10 years. Working with a nonprofit organization and then in the drug court, treatment court down there for 4 years. And I mean, we had an Alano club, you know, that has the meetings. I mean, we had 300 meetings a day. I mean, they had yoga, they had Buddha, they had MAT recovery. I mean, they had a meeting for everybody because it's, you know, it's so multiple paths now. You know, it's not just AA, it's not just NA. There's so many other paths. You know, and I got clean in NA, but then I went to AA and I went to Smart Recovery and I went here and I went there and I made my own recovery and that's what works for me. You know, and that's my goal is to help people up here to bring that up here to them. To have a place they can go, you know, bonfire meetings. I'm having one in a couple weeks, you know, at the campgrounds, you know, just different things like that, you know, just stuff that they can do, because if there is nothing that they can do and they cannot connect together, they're just going to go back because they don't have those supports. And we need a recovery community, but we need a place and activities and stuff that they can come to.
So this is like a physical location where it's like a hub for all of those resources.
Like a lot of other counties have the recovery world. As many put it with Ogemaw, we're in the desert when it comes to recovery. However, this is a great start, us sitting at the tables right now.
Absolutely.
I could go on and on. I think that we need, I don't like to say the word need, but I think that we could really use peer recovery coaches or sobriety court or drug court.
Yes.
We're needed out here. We are. And
I've been working in sobriety court and I got Judge Bennett to, the requirements are 2 in-person meetings a week and 2, they can do 2 virtual, like Zoom meetings or whatever. And if I have a couple clients that meet with me and Judge Bennett is letting that count as one of their meetings. Because there's only one place to go here for meetings, really. I mean, unless you go out to Prescott or whatever, most people don't have transportation. So there's only one place to go and it's like one option, and some people that's just not a good fit for them. You know, and when we meet, I give them homework, you know, I give them stuff to do, homework. I mean, we start from the basics, you know, and I can work with them as long as we need to, you know, if there's no ends that I can only work with you for 6 months or something like that. You know, we're going to a treatment center, you know, they get to work probably with a peer there too and that sort of thing, but then it's done. And then what do they do after that? You know, it's a lifelong process that just is continual.
So one thing that I could see also benefiting of it is for this hub or this facility. So it brings them all together. And then I'd imagine that they really feed on trying to be accountable for each other.
Oh, absolutely.
That's a big part of the process.
Yes, it is. Absolutely. Because they have that support from other people that are just like them. You know, my parents didn't understand my addiction. You know, my sisters, I can't go to them and, you know, but I could go to Shannon, I could go to her, I could go to, you know, I can relate to my clients because I've been there. I've done that. I know how you think. I know, you know, we can just relate so much more. And we're on their level. We meet them where they're at and help them to get where they need to be so they can live a life in long-term recovery.
That's good stuff.
One thing I've wondered since the last meeting, and maybe this is kind of off topic, but I think it's somewhat. Are there resources that we have that are just completely underutilized, where that person that's facilitating that is just not meeting their potential with, do we need to get more people to them, or do we need more people to do it?
More people to
We
do
need
it.
more people to do it.
So people are receptive and.
Because there's resources in here that offer some things, but if we can get some more of the communities involved, like the churches. The free clinic, just some more people, just like on the prevention coalition. Get more people involved that can help with like donations. I started a meeting that my clients come to, some from MDOC. I have clients through MDOC that I'm working with. And then I started a meeting, it's just called Simple Recovery. And we've been working on anxiety, and we made calming jars, we made glitter jars the other night. Just different things for them to do instead of just, going to a 12-step and that's all there is.
So where did you do that at? What?
We have Catholic Human Services has a small satellite office right by St. Vincent de Paul. So we were meeting in the kitchen, but I've got more people coming now. So my office is at the new My Michigan Health Park. I have an office in there because we, My Michigan and Catholic Services combined together, because they got some monies building up an SUD, facility here is the hope, if I'm right, Kathy. And so I was a part of that. So I'm embedded there. So any of the physicians that have people with SUD, they refer them to me. And they have a conference room that I can use. So we're gonna start our meetings there next week, and I'm gonna put flyers around, even at the club, it's open to anybody. Just to give other options to people, because that's what they need. They really do.
Thank you.
Yeah, you're welcome.
My smart recovery meeting, this summer, we went down the river on the Asable. We went to music in the park. I took them for pizza the other night. We just need a safe place that they can go to.
And do
And
normal
you-
activities that alcohol and drugs aren't around.
And you mentioned getting the churches involved. I have more in Skidway than I think that we do. We have a personal needs pantry in Skidway, a
Mhm.
church to do the personal needs for laundry soap, shampoo, conditioner.
Yeah, we don't have that here.
There's so much needed. I know we can't do it overnight. I know.
No,
we're
well, I
doing
know.
A lot of things. We got big plans.
Yeah.
However, in one church do gas cards,
Mhm.
one church. If we can get it all together.
Don't let me go without talking.
Okay.
I have a class coming up of new EMTs,
Okay.
and I want to find a project for them.
Sure,
So
absolutely.
nice.
Very nice.
Absolutely, yeah. And I'm trying to get in the jail. I'm working on the courts, the sobriety court. And trying to get in there, with them and, and get them to come to other meetings and, just to be a support if they don't have a peer, and down in Kent County, we had peers in the courts, and I worked with everybody in the court. And it's a big difference to have somebody, that understands and that's been there than just your PO telling you what you gotta do, or the judge telling you what you gotta do. They got, learn how to live. They want you to do all the requirements, which is great, but you gotta learn how to live,
Okay.
So I'm happy, we're
All right.
happy.
Well, thank you.
I could go on too.
Okay, we can keep going then.
Okay. So then the third question is about gaps, which we've already started talking about, which is good. I've taken notes on that. But what are the gaps in services in responding to the opioid epidemic in our county? And then sub-questions, what resources or support systems are currently lacking in our community to address the problem effectively? What do those impacted, so individuals and their friends and family, need from the community? And what are some of the barriers preventing individuals from seeking help?
Mhm. Those are good, all good.
I like those.
Mhm.
And then question 4, how do you think we can create a more compassionate and stigma-free environment for individuals struggling with addiction in our community? How can community members, organizations, and local governments work together to create a comprehensive and sustainable plan to combat the opioid epidemic?
That's a good one too. And for me, that would be education.
Mhm.
Education, I always throw my husband out there under the bus. I'm like, yeah, I brought you up today. My husband, is in recovery as well. He was a 20-year heroin addict. He got burnt, in a burn unit for 3 months, started him on the opiates and Oxycontins and all that stuff back in the 80s, and it just went on from there. And he went to a new physician, because our physicians were still in Kent County, but we found new doctors up here for ourselves, PCPs, and he goes to Dr. McMorrow's office. He's on Suboxone in Houghton Lake, and he went to the new physician out there, and he opened up his chart and saw his history. And my husband almost walked out of there because he was just like, why are you on this? And why are you on that? And, just because he doesn't have any education around it. There was an instant stigma just by looking at his folder, his file, that I got this drug addict coming in here, and by the end of their appointment, he apologized. He said, I am so sorry. I didn't even meet you. I didn't even whatever, my husband has never overdosed. All of his friends have died from overdoses. He only used to not get sick, until he found MAT, because his family didn't know, nobody he knew was in recovery. He didn't know about that. So he just used so he didn't get sick. He didn't go through withdrawals. That was it. He functioned, he worked his whole life. I mean, everything. But just that there's a lot of stigma up here. And I think it's just education that we need to do, around that and what addiction really is, and not just to the professionals, but just to the community itself.
I was gonna say, it would be nice to add into that, like, some sort of like, questions that deal with like sources of stigma and what kind of stigma people are feeling. So that instead of having like a more nebulous, like, let's combat stigma approach, maybe get some specific ideas of like actions that we could take, or like communities that we could target with that.
Sure, absolutely. Absolutely. And that's another thing that we can ask our clients too. What have they experienced?
I advocate, that's what us peer recovery coaches do. We
Advocate
go
for
with
them.
our clients to the doctors. I've
Mhm.
had to advocate for myself for, 5 years.
Mhm.
I think, and I don't know how we target this, but like you have a captive audience with people who are actively seeking treatment and want that help. But how do we use this to reach beyond that and probably make yourselves more busy?
Right.
But how do we reach beyond that to people who haven't made that commitment yet? Because I want to know what they view as those resources available and what's stopping them from, is it stigma, or is there something else that's prohibiting them from making that decision to say, hey, I'm ready to make this jump?
Most often it's childcare. When you have one or two people who are sick in the home, if they go into treatment, they have fear that that's going to result in a CPS case. I'm now having to divulge that I have a problem. And if there's already a CPS case or other things going on in the home, it just compounds it. So that's sometimes one of it. The other one is loss of job. The perception that person might have in the community. I meet doctors and physicians and people in the court system all the time that say, I don't even know where to start. And I have a fear of losing my job if I even talk about it. How did you get to where you are, where you can go into a room and say you're a person in long-term recovery and not feel that everyone's going to look at you differently, or you're going to have to worry about if you're going to be fired tomorrow? She said, I can't do that in this community. So it is a lot. There isn't like one stigma against medication or MAT. It's stigma across everything. It honestly is. And then when you reach out for that help, it's the stigma that you get, or if you confide in a doctor, like she's saying, went to a different doctor and faced the same stuff. So it's across all sectors.
In Kent County, we had a professional, professional treatment for professionals. That was private.
Yeah.
It was concealed for them. If there's anybody, in the professional industry that is having issues, so that was all, privately for them. So it didn't get out in the public. Not everybody knew, and they just had their own little recovery community, so to speak.
I think in part of that too, I kind of see a lot of these social determinant things. A cornerstone of a lot of those is lack of access to housing. So things like housing discrimination too, because if you don't have that, it's hard to build anything else.
Correct.
And I don't know about you, I mean, most people that come into recovery and they have life of addiction, they got a record. You know, they got a record. They got felonies, they got this, they got, you know, that and everything. And, you know, and there's still some discriminating against that too, you know, where recovery housing would give them a chance to get on their feet, you know, to save some money, you know, and then we would work with them to help them to find their own place, maybe a private landlord or, you know, I don't know what down the road, but there's so many, I mean, it's enough to get clean, but then now you got a record for the rest of your life. How are you gonna get a job? You know, so there's so many barriers, you know, and people change, people do change.
I want to just jump in on that too, is that I know at my mission, we did need to change some of our HR policies so that we could hire people who had lived experience with substance use because, you know, working in a healthcare setting, there was pretty strong policies around not hiring people with certain types of convictions. And so we did have to do some advocacy and have some changes so that we could hire folks. And I'm assuming we're not just hiring them as recovery coaches, but in all types of jobs, but it was a little bit of an upward climb in order to be able to do that. And I think that, you know, having some advocacy maybe with the, you know, your business folks around hopefully not having to discriminate. I'm looking at the school principal and I'm thinking you probably have some rules where you can't hire, you know, just anybody with any type of convictions or whatever. And that was sort of true for us as well. But we were able to make some changes. We can't probably hire into every single job, but I think that's an important one because people who are in recovery and they need to be able to, you know, get on with their lives and have careers.
Second chances. I love that. Also, our role can be to help them with the applications to get their records expunged with the second chances. Yeah, we have a pretty big role, don't we?
Yeah, we have a lot.
Reinstatement of driver's license.
Yeah.
Transportation.
Yeah,
Foster care.
everything. I mean, everything.
Thank you.
I wanted to ask, and I'm getting a little bit ahead of myself because this is something I normally do later in the process, but you did bring up a really good question earlier about how can we reach the community that isn't necessarily in recovery yet or near recovery yet. And so this is just a question for myself and for my own notes, but in other communities where we are trying to reach that kind of population, harm reduction efforts or syringe service programs is a place that we've been able to get in touch with them and hear from them. So I was just wondering if there is anything like that within the county that we might be able to tap into.
That's on my list. I wanted to, that's also on my list. We were just talking about that. I would like to see if any of the police departments or I do need to get to the smoke shop in Skidway, Narcan boxes. They're the old newspaper boxes. I know in other counties, they're in police departments, they're in smoke shops, they're in outside grocery stores. That they can just go and grab their boxes of Narcan.
Yeah. We've been doing that. Catholic Human Services
Yeah.
says we've got them all up there. We just don't have them down here. So
Well,
it's a matter of going to places.
We have it at the health department, but the health department here in West Branch isn't necessarily a central location. And it's in our lobby. So if you're not coming in for other services, it may not be that visible.
Right.
But we also have syringe service programs and other harm reduction we do through the health department.
And I do, and I know you do too. We do distribute Narcan. However, breaking that stigma that they can just walk in somewhere, open up the door and grab as many as they want. It's free. It can be replaced.
And it's going to be somewhere that like, yeah, they're not going to be recorded or feel like that they're going to be monitored in any way.
Right. And to your, what's her name? I'm sorry, I can't read. Brianna. And to her question about, you know, trying to reach that population that hasn't come, I mean, going into the jail and talking to people, that, are in there for drug related, how come they haven't gotten into services, or, they're there for 2 or 3 times, or even over at MDOC. I was there all day Tuesday with, Diane. Cause it was her, report day, and, she introduced me to a lot of people, and some were like, okay, yeah, I'll meet with you, and the other ones are like, yeah, I'll call you, and then they called today, so they're hesitant, and this isn't their first rodeo. So those would be good people to ask. Why are you hesitant? How come you haven't really tried, or what have you tried before that didn't work, or what wasn't there for you, or, that sort of thing. Because I think most people, even if they're not ready, they don't want to live this lifestyle forever. It's just a matter of, getting them ready, which is another thing that we do. Right?
Planting seeds.
Yeah, planting seeds, absolutely. But that would be a good resource for that
Thank you.
as well. Mhm.
All right, so that's all of the ones that were sampled. Are there any questions that you would want to ask of your community? Anything that isn't touched on that you think is important to look into?
The question after hearing all this is, how does somebody find out where to go? So if I'm like new to the community, I mean, I don't know anything that's there, where would I turn to?
You would
start?
probably just look up Ogemaw resources and go under alcohol and substance abuse and see what's there. Or they can call 211, or, if we had a recovery like community place, they would know. We'd have a Facebook page or something that was, recovery of Ogemaw, resources, these events are going on, once we get there, that's my goal.
There's also a push in like the healthcare sector to do no wrong door, so that if someone like goes into any place and they start, saying that they have, issues with substance use, that they'll be able to be referred to whatever is available
Right.
in the community.
Another good option is somehow connected to a recovery coach, but there needs to be more promotion of what the recovery coaches that we have. Recovery coaches are like resource brokers of those communities. And so they already know what all those resources are, where someone can get services or treatment or care or support. So that's one big piece of it. And like, already been called out, having those recovery coaches going in, doing jail-based services so that prior to discharge, there's a plan.
Absolutely.
Recovery coaches, within counseling centers, but also within the court systems. So again, while they're struggling through that process and we still have to face our judgments, but they can still start pulling those pieces together to rebuild their lives at the same time. So, and then there's family coaches that support the family members of those who are struggling. There needs to be like just wraparound support of
And
all across the board.
there's not very many recovery coaches in Ogemaw County, is there?
I only know of me and you.
Oh, I've got Mandy and Joe at
You two are
CMH.
gonna be busy.
I know, my schedule's already getting full.
I know we used to have one at the health department, but that was pre-COVID, and I think we lost the funding for that.
And I'm
position.
out here scouting, trust me, I am, like, who would be good candidates?
And
So-
recovery coaches in the emergency room departments. So when you have people present with
I think
drug or
we're in
alcohol
one. I
problems,
thought
there
you-
is.
We
We do have that.
Here,
Yeah.
right now.
Okay.
We have Project Assert in the,
Yep.
Yeah, Project
Okay.
Start through 1016.
in the My Michigan. I don't know if McLaren's ED has an advocate.
I don't think so, Kathy, not yet.
Okay.
And I want to connect with them, whoever that is, he or she over there. Because they connect with them in the emergency room, but they might do a follow-up call, but then they can connect with us in the community. So we can continue that care for them and support.
I have a question for Shannon. So Shannon, you said that you're out looking for more recovery coaches.
Well, I'm based out of Tawas and Oscoda right now, Iosco and Oscoda right now. And I have 2 people through Oscoda that just got done with the peer recovery training. But they have to look in their area. Here with my smart recovery meeting, I just got a facilitator to do the training that is taking over my class right now. We can't just say, hey, I want you to be a peer recovery coach. It doesn't work like that. It's whether or not they want it, if they're ready.
And there's,
Right.
sorry.
No, go ahead.
No, and there's a lot. Are you through the state, through MDHSS?
Yeah.
Yes,
Okay.
because there's a certification, the recovery coach training that people can go to get their certificate. I mean, it's very helpful. It's a great class, but it's, to me, this is my opinion. It's more, because I took it too, and I think everybody should take it. And any jobs usually require you to take it. But it's like a certificate. But to get the certification through the state of Michigan, it used to be a couple different certifications. Right now, it is all together through MDHHS. And you have to work for a place. You have to have so many hours that you work with clients. You have to have so many supervision hours. You have to take trainings, ethics trainings, all kinds of trainings every year. You have to renew your certificate every 2 years. You know, it costs money, but that is all what you need to do to be a certified recovery peer coach.
Okay, so my next question is, so to be a certified peer recovery coach, you're employed by Osable Valley, you're employed by Catholic Service. Is that peer recovery part of your job right now? Like, are you being paid by your employer to be a peer recovery coach, or is this a whole nother?
Oh, no.
No.
Okay, so
Yes.
Osable Valley is looking to bring on more peer recovery coaches
Well,
that would be
we're hoping.
compensated.
We're hoping, but.
I'm saying they have the
we'd like to-
funding for it.
We'd like to get some hired through the drug court. We'd like to get some hired in the community, period.
All right.
So
Okay,
can I
I'm
just
gonna
jump in on this?
Yeah,
If it's okay, so to my knowledge, there hasn't been good funding streams and reimbursement for peer recovery coaches. So I know that there is some newer funding streams and things for community health workers. And I know that Joyce, who's there, has offered through her organization to help peer recovery coaches get the training to become community health workers. But to my knowledge, there isn't a good reimbursement. And so how my Michigan has moved forward with paying for Sonia. So is that we had received and continue to receive a little bit of money through Blue Cross Blue Shield. So Blue Cross Blue Shield reimbursed us some money if some of our doctors give medication for opioid use disorder, and they give us like an incentive. And so they give our health system an incentive for however many patients that we're seeing and helping with that. And so we've coalesced all that money. We didn't give it all back to each doctor. We coalesced it so we had enough money to hire a recovery coach. And we're hoping to hire another one, probably for Clare County. And so it's been a little bit of an uphill battle, I would say, and getting good reimbursement, good ways to be able to pay for peer recovery coaches. And that's why I think they haven't exactly caught fire. And so for our peer recovery coach, or they call themselves wellness advocates for our emergency department, the regional entity, Northern Michigan regional entity pays part of that. And then my Michigan pays part of it. So just out of our funds. And so there's not, and we don't get any reimbursement at all, but we know that it helps patients in the emergency department. And sometimes it helps them to move along faster, which is something that, we don't want people boarding in our emergency department. So every minute, does cost money. And so that's another, it's a good reason to do it, but also just better patient care. So just adding that little nuance about how to pay for it is not super easy. And so these opioid funds might be, if the county commission and everyone believes that the use of peer recovery coaches and paying for that with this type of funding, say for your drug court, it could be something you decide.
Right. And when my experience working in the court, and even here, I was under a grant. So they wrote the peer into the grant because those are usually, they're all funded by grants, So once they wrote it in, then, it was automatic, we were there. for that time, as long as the grant, and then now they had to renew the grant, they write us in again. So it's not like a hired, and even MGOC too, you know, they get some, I don't know with them how that funding would work with them. You know, to have a coach there, but right now I mean, we're there for free, you know, people ask me, clients ask me, well, what about insurance? Is my insurance gonna cover it? No, there's no insurance. We're mobile, we can come to you, we can meet you wherever, we can go have coffee, we can, you know, go do whatever, and we're for a free service.
But
You
you
know, to
can't
the
be-
community.
It's free to patients, but it's not free.
Oh, no.
So
What you
Yeah.
we get this money from Blue Cross and it may not stay forever. And so then we have to decide, okay, how are we gonna then pay for it? Because if there's not reimbursement, then it's just, and sometimes, I mean, health systems are 501c3s. And so community investment is something that we do, but I just, you know, want to make sure people understand that it's
So you
not
tell
really,
me I'm gonna lose my job, Kathy?
no.
Just kidding. I would do it for free.
Don't say that too loud.
Yeah.
I know, well.
I'm just gonna speak to the school side of this. I think some information that would be helpful to us would be kind of breaking it down into age groups and what substance in age groups is most prevalent. All of our students receive health class as freshmen, but they're pretty far removed after their, you know, freshman year. They move on and then they get introduced into a lot more things. So while they get the education when they're 14 or 15, then by the time they're seniors and they're 17 or 18, they've been exposed to a lot of different things. If we could have the information of, you know, what are 18 to 21-year-olds seeing or being exposed to or using, then we might be able to offer some preventative measures for our seniors before they go out into the real world and have some of these experiences.
And speaking of age too, we need to make sure that any assessment we do captures the older adult population because they often get overlooked, but they get opioids most frequently from their doctors, and it's the largest population group in our county.
The doctor that my husband saw yesterday, he has a patient that's 102, that's opioid in recovery. Got a couple of them that are in their 80s. So, yeah.
So is it
Oh, go ahead.
Mrs. Ziegler?
Yes,
Right? Ziegler?
Yep.
And so you're the high school principal, Ogemaw Heights?
yep.
Okay. Currently, what type of, are you seeing a lot of this, or not a lot, I hope not a lot, but are you seeing some of this activity with active students?
I mean, there's always a vape problem, you know, but that's kind of a thing to itself. But I would say alcohol and, you know, marijuana is pretty accessible in a lot of different forms, including dab pens and things like that. So those would be the two things that we are most aware of. But again, you know, we're not with them when they're at home or on the weekends. And so there is probably a lot of stuff that I have no clue about that they're doing that they are actually doing or exposed to. We're also seeing a gigantic influx of kids getting hurt, broken bones like crazy. And I don't know what pain meds they might be prescribed to as a, you know, a minor,
Oh, yeah.
but that might be something too that could at some point take some form of abuse.
Oh, yeah, I have a lot of family members, from injuries from sports that, some are in recovery and, some are still lost, per se, sick.
Yeah.
So,
And then I have to excuse myself because I have to go to the football game. So,
Have fun.
Thank you.
yeah.
Thank you.
And unfortunately, I'm gonna give you my card. I have to leave too. I have guardianship of my 2-year-old grandson and he's at daycare and I have to go pick him up.
Gotta pick them up.
I gotta go get him. My husband's out of town.
Thank you.
So, yeah, there we go.
good to see you. I'll call you.
Yeah.
Thank you
If
so
need to
much.
Give me any more information.
Thank you.
You too.
Yeah, I'll call you.
Let him know if anything else happens here.
Yep, I will for sure.
Thank you.
about time you got this for me.
I know.
I want to just jump in on something that I heard a little bit earlier about older adults, and I would want to second that. Sometimes what we find is older adults come into the health system and for one reason or another, and we find that they are on the medical floor and start detoxing. So they start getting in withdrawal for alcohol use disorder or opioid use disorder. And so that is a challenge when that happens, but it's not really unusual for something like that to occur. So I think we don't want to forget about our older adults. Also, with regard to opioid prescribing practices, I think that, over the last 7 years or so, that's changed pretty dramatically, where people aren't, doctors are not giving out opioids to the same amount or at all. And sometimes it's caused problems because people who may benefit from that in the short term sometimes can't get it. So just wanted to make that point. I don't know if Dr. McGram, if you have anything to add about that, but I know that there was just a pretty big shift, and sometimes people were not, like, they were under medicated, but
Yeah.
I have a couple of slides on Ogemaw County's overdose data that I can share with the group. It does dial it down by age, and 45 to 55 is the highest age group. The only thing I can't pull is by substance, as I think it was Ms. Ziegler requested. We don't have it broken out by that. That would have to be a community poll of, what they think is aware in this community. But Dave, did you have anything else to add?
Well, I would agree with Kathy Dollard. I think opioid prescribing is a lot tighter than it was 6 or 7 years ago. Typically, it's a 3-day course coming out of an emergency room with follow-up. So, yeah, I would agree with Kathy. And listening to the conversation, I think a lot of counties are looking at recovery services, and I like your discussion about recovery coaches. And I think that would be a great use of opioid funds for a recovery coach in the court or wherever else it might be deemed necessary.
Has anyone brought up the substance use vulnerability index?
I have not.
That's a new tool that was created by MDHHS and it rolled out last year. It's really interesting. It goes county by county through the state of Michigan, and it evaluates about a bunch of on a bunch of different opioid related factors to come up with like a single score, and then ranked all the counties. Ogemaw County is pretty high up there in terms of like where they rank. I think it's like 26 out of the 83. And where we're falling higher on is the burden of it. We have a high burden of opioid use compared to the population. And at least by the metrics that they used, we're actually considered higher up on the scale for services. And a lot of that is because they said like, well, do you have one SSP? Do you have one NSO? And if so, they're like, oh, check the box.
Yeah.
So I think a thing too is making sure that the assessment looks at the density of those services and how accessible they are to people. And that goes back to like the problem of transportation.
Yeah, thank you for bringing that up. They actually just updated that too. I wasn't sure if you know, but you can now sort by zip code too. So
I did see that. That's really nice.
Where do we access that at?
I
I can
can.
put a link in the, well, that might not be helpful.
Yeah.
I think if you search like SUVI Michigan dashboard, and it's the pages like data at MDHHS, and it'll come up with a Power BI dashboard that you can kind of go through and look at that data. It's really interesting.
That was SUVI.
SUVI,
Yeah.
Substance Use Vulnerability Index, and our area of the state, the Northeast Lower Peninsula, is really like what came out as being hammered hard. Just to the north of us, Oscoda County is #1 on the list for that vulnerability.
It's pretty rough over there.
Yeah.
I've been slammed. It's rough over there.
Right, so I have all of the guiding questions with the edits and additions that you guys provided. I will send them after this meeting for you all. As for next steps with this, I was hoping that I could maybe send over an Excel sheet or some way to collect just kind of where you guys are thinking we could survey or do focus groups with. So whether that's with individuals that you're serving currently, whether it's with your coworkers or yourself, just where we can start getting an idea of where those sources of information might be located.
Yeah.
Awesome, thank you so much.
Thank you.
Depends on who you have to.
So we had no Amy tonight.
She was on there.
One, but yeah,
What's that?
there was one on there.
Yeah.
I think she's gone.
I don't think it was Amy from Mac.
No, it
You said-
wasn't our Amy, was it?
You said she's off the grid.
Also, she said she's in Tennessee in the mountains.
Nice.
Maybe she tried.
And that's what I'm thinking.
Yeah.
Tried and lost signal or something.
Yeah. And, from here, do we want to do a roundtable to see if anybody wants to have any more thoughts on our conversation from today, or? We've got everyone that was planning on speaking's already spoke, right?
And I think I'm gonna look forward to what Brianna sends to us as well, but I really want to hit this dashboard that Scott mentioned. I think there's gonna be a lot of information there that's gonna get right to what we were wanting to do with the demographic.
Yeah, and it gets a good question at the burden, and then at least for me, it prompts other questions to try to get down further into that data and see who specifically like is overdosing and stuff like that, which I don't have access to that data as at my level, but if this assessment maybe could get at some of that, I think it would be really helpful. I'd love to see it.
Be curious too about regionally. We mentioned Oscoda, but what's happening there may be coming here. I mean, it's gonna be good to get the heads up.
Oh, absolutely. Yeah. On the SUVI, if you go to that SUVI data, there's a tab where you can cross-reference different factors. And if you cross-reference the SUVI by overdose mortality, our little corner of Northeast Michigan makes like an L of just like the highest overdose mortality, highest SUVI, and that's really troubling.
There's also 2 other dashboards, just while you're talking about it, that I was recently made aware of from Chicago's NORC, called the Recovery Ecosystem Index Map, and the drug overdose death. They just have one of drug overdose deaths where you can overlay with other like socio-demographic or economic points. So if you're interested in more dashboards, those 2 are also.
Thank you,
interesting.
Regina.
Yeah,
Thank you.
I'll definitely look at that too.
Does anybody else have anything else they'd like to bring up right now or discuss, or any thoughts for our next meeting? If we want to try to get involved.
I'd like to thank Joyce for driving all the way from Gaylord.
I was,
So-
you don't have to thank me. I was gonna thank all of you for allowing myself and Dr. McGrahm to attend. We know this is overwhelming for the counties and you don't know where to go, we just appreciate being invited to the table, myself specifically as a person with lived experience, knowing what the needs are in most communities, what the gaps are in others. Just appreciate being able to be here.
Did you get an
Thank
email
you.
directly from us?
I believe I did.
Okay,
Yes.
so make sure you're on the list.
Yeah.
Thank you, we appreciate
Mhm.
it. See anybody else on Zoom? have anything to
Oh,
say?
okay.
Here,
No, I'll give him my card.
we'll give you her card, because I
It did
forwarded
forward
it
from
to
her.
her.
Okay.
Yeah.
I do want to say, at the next meeting, you'll probably see, Heather LaForce, who's the nursing administrator at, the district health department, and, she's great. She'll have, a whole bunch of, insight as well, because she's the one that runs our like harm reduction programs and stuff like that.
Are you gonna stay involved or?
I would love to be able to support. I don't know what my time availability is, but if there's like need to help, like, run the assessment, push it out to the community, do analysis, I'd love to do that.
Oh,
Great.
heck yeah, and I'm not good at technology, so you're gonna fit right in.
Contact.
It's kind of what happened with the health department. They're like, this is math, Scott can do it.
Well, thank you, guys.
Yeah.
Thanks for having me.
I wanted to say that, I did check with, Mid-Michigan Community Health Services, our partner for the new, medication for opioid use disorder clinic that is planned for, West Branch, because I wanted to try to get a timetable. So they're waiting on, some permission from the state, to open as a satellite. And, but they anticipated that might be, November 1st. That's sort of what they're targeting. So that's for the clinic that will be on Progress Street,
That's very cool.
3
That's
days. a week. So,
Yay.
And then do you know how much funding you have there? How long funding's available to keep that?
yeah, that's an federally qualified health service. So I think that they're funded in a different way. Where like Medicaid and Medicare is maximized, and they do like a cost settlement at the end of the year. So their funding is pretty secure, I think. The funding, we were gonna use Sonia, who you met today, have her be a liaison with that clinic and our health park, so that because we hope that we're serving similar, like some of the same patients, and so there might be some need for an additional coach. And then I think that my Mid-Michigan Community Health Services uses Catholic Human Services for a lot of like their therapists. So I think I can check with them to see if there's any additional funding needs for that, but as a QHC, usually they have that kind of federal funding.
Thank you.
Mhm.
All right, so I guess we can look at for our schedule for our next meeting.
How does the second Thursday at 5 o'clock work just in general? We can,
Just kind of stay with that.
yeah.
I think that's good. Promote participation, just make it the same time.
Right.
Consistency.
Yep, exactly.
So that would be the 9th. The 9th at 5 o'clock.
That works for me.
That's what it is on my.
And we'll keep it right for here. November 9th, 5 o'clock. All right, anybody have anything else or?
Just one quick thing, one other handout that's here. The board this morning generously allowed us to share a legal opinion from our attorneys, and I think we had the conversation just a little bit here too. And the question was whether or not we could use the opioid funds to help with the administrative costs for keeping this group going. And the answer is yes. This is the long version of the yes. It explains why different parts of the settlement say that it's okay. Now, our immediate thought was obviously the county is some expense in putting this together. To be honest, that's not a huge amount, but if we get going on this and really get a plan running together, we may need to tap those funds to help get some of the resources that we need to be able to make the right decisions. So this is, I think, a very good a positive response. And for the first time, we got a yes answer. We've
That's
been
our
no and
first.
everything else.
It's our first yes.
Yeah,
Build off
there
that.
you go.
A roll.
Recovery.
Thank you, Tim. All right, you guys. Thank you, everyone.
Thank you.
Have a good night.
Thank you.
We appreciate all of you. Oh, thank you very much.
Yeah, you bet.
guys. Really appreciate you.
Yeah.
Nice.
Get it already.
I probably do. Let me see.
Yeah, I want one of yours.
Drive safe. Back.
I will, thank you.